Hi, my name is Rebecca Cedillo. I'm a 25-year-old cystic fibrosis patient. I was asked to create a short video about my life with cystic fibrosis. A lot of you watching this may not know what cystic fibrosis is, also known as CF. It is a genetic disease that primarily affects the respiratory and digestive systems. Because it is genetic, that means that it's not contagious. Your mother must have a defective gene, your father must have a defective gene, and together they have a baby. That baby will have a 1 in 4 chance of being born with cystic fibrosis. There are over 1,500 identified mutations that cause cystic fibrosis. With that being said, it is very important to note that every cystic fibrosis patient is different. There are no two cases that are exactly the same. Cystic fibrosis can range from mild, moderate, to severe, and it really depends on a number of factors, including genetics, environment, and I guess really how you take care of yourself. CF primarily affects the respiratory and digestive system. The body overproduces thick, sticky mucus, which allows bacteria to find a nice, cozy place to live, and once it is there, it duplicates. And these bacteria are things that normal people, and by normal I mean non-cystic fibrosis patients, are exposed to on a regular basis. Because they're normal, they don't have this defective gene, they are less susceptible to the bacterial infections. Someone with cystic fibrosis can be exposed to something such as Aspergillus, and it can cause an exacerbation, which can lead to the development of scar tissue, loss of lung function, and a decrease in oxygen levels. As far as the digestive issues go, CF can cause malnutrition, low vitamin levels, poor weight gain, and the pancreas does not properly create enzymes, so many CF patients have to take these. These are man-made enzymes. I take 6 with each meal. They are Creon 24,000 units. Whenever I do not take them with each meal, I suffer from severe abdominal pain, and my body does not absorb any of the nutrients of the meal that I just ate, so essentially it's like I didn't even eat. Back to the respiratory issues, this may look familiar to you. This is a nebulizer. This is the mouthpiece, and in here is the cup. CF patients who have lung issues, which is a majority of them, must do nebulized medications multiple times throughout the day. I am currently doing 4 treatments a day. I take albuterol, pulmozyme, hypertonic saline, and tobramycin through the nebulizer. What happens is you pour the liquid in here, and you plug it into an air compressor, and it turns it into an aerosol, and you inhale it. Albuterol is a bronchodilator, meaning it opens up the bronchioles and allows for an easier flow of oxygen, and tobramycin and the other ones are antibiotics and medications that alleviate the effects of the bacteria in your lungs. Let's see, cystic fibrosis is not just respiratory and digestive, it also includes cystic fibrosis-related diabetes, osteoporosis, arthritis, and liver disease. I was diagnosed with cystic fibrosis at the age of 6 after being misdiagnosed for a number of years. My mom says that whenever I was born, she knew that something was wrong. I'm not sure if that's her way of telling me I wasn't a cute baby or if she just knew that I was sick. Haven't decided yet, but we're going to give her the benefit of the doubt and say that she just knew that I was sick. So 6 years after being diagnosed with severe asthma, bronchitis multiple times, pneumonia, and a number of other medical issues, I was being wheeled into an operating room to have my appendix taken out, and my mom reminded the doctor, hey, did you get the results from the sweat test? The doctor insisted that he did not have a sweat test because he was so convinced that I did not have cystic fibrosis that whenever he came back to the hospital room, according to my mom, he was as pale as a ghost. A sweat test is what is used to test for cystic fibrosis in babies primarily. They measure the sodium in the sweat. There are a lot of basic underlying mechanisms that go along with that we don't have time for today, but you can read more about that on my blog. Excuse me. I was really short, very thin, and had frequent bouts of pneumonia and bronchitis, and I had severe digestive issues. Throughout my adult life, I've been hospitalized on average 2 to 3 times per year. I get IV antibiotics through a PICC line a couple of times out of the year. This is a PICC line, peripheral inserted central catheter. This one is about 27 centimeters long. What they do is thread it in through a vein, and it stops pretty close to the heart, and this part sticks out. This is where the medicine is entered. Medicine just flows through here, and you can lock them and unlock them depending on whether or not medicine is being administered. Most CF patients either use a PICC line or a portacath. A portacath is a long-term IV. This is long-term, but portacath lasts longer. Can last from about 6 months to a year. These are more for a few weeks to a few months, depending on how frequently it's accessed. So portacath are usually placed right about here on the chest, and they are only accessed whenever the patient needs IV antibiotics and to flush it with an anticoagulant, which means that you just flush it to make sure that there are no blood clots developing. So in 2012, I was the sickest. I was in the hospital 4 times out of the year for a couple of weeks at a time, had 3 PICC lines that year, and in addition to that, my last hospital stay, I was given an antibiotic that I'm severely allergic to. I had an anaphylactic reaction, and as a result, I was a little bit traumatized. But my doctor came in that day and said, after a long discussion of me saying maybe this is just my baseline, maybe I just cough a lot now, my doctor told me that on average CF patients lose 4% of lung function a year. I was very upset personally and professionally at my doctor because I felt like he was maybe desensitized to the fact that I am a human being. These are the only lungs I have, and I like to live and I look forward to living. And he just told me that statistic as a matter of factly. I was very depressed and disappointed and focused on the most negative things of my diagnosis during that time. Shortly after I was discharged from the hospital, I decided to invest in a pair of running shoes, and I started running. In the beginning, I could only run about 15 seconds at a time, but over the course of 2 years, I can now run for about 10 minutes without taking a break. I have found that for me personally, exercise is one of the best treatments I can do for myself. It helps me cough up mucus and clear my airways easier than any prescribed medication has. For those of you that have cystic fibrosis and are watching this, I strongly encourage you to talk to your doctor before you create any exercise regimen. Anyway, people with CF are frequently hospitalized due to the pulmonary and digestive issues. These hospitalizations are referred to as tune-ups. I'm going to the hospital for a tune-up, or, oh great, another tune-up. These tune-ups include physical therapy, breathing treatments throughout the day, blood work, checking blood sugar levels, oxygen levels, arterial blood gas, and things like that. The average lifespan of a cystic fibrosis patient right now is about 37 to 41 years old, depending on a number of factors. I don't know about you, but for me, being told that I might not live past 41 and the odds are not in my favor is a very depressing statistic that I have had to live with. I have suffered from survivor's guilt and depression as a result of my chronic illness. In 2010, I lost 3 friends to cystic fibrosis, 2 of which were post-transplant and 1 who was waiting for a lung transplant. And over the course of the past 4 years, I've lost a total of 7 friends because of cystic fibrosis. On the flip side, I do have a friend who is in his early 40s who just had a lung transplant and is doing very well. Like I said before, every case is really so different and so diverse. It's important to note that cystic fibrosis is a continuum, not a dichotomy. There's no black and white. It's just this very broad spectrum of symptoms and illness, and it really just depends. For many CF patients, organ transplantation is essential to giving them a quality of life. It does not cure one of cystic fibrosis. It only temporarily alleviates the negative effects of it. And for those who receive organ transplants, such as lungs, they essentially trade in cystic fibrosis of the lungs for possible rejection of the lungs. Organ transplants are very pertinent to the success of CF patients and just giving them a quality of life. Unfortunately, there are not enough organ donors, So if you have not signed up, please visit organdonor.gov, and you just have to fill in a couple of lines and you'll be good to go. So in the event that you do pass away, you will be able to essentially save the lives of 8 people. I encourage you all to visit www.cff.org to learn more about cystic fibrosis and how you can help, how you can be an advocate for the Cystic Fibrosis Foundation, and you can also learn more about clinical trials, research, and where we are with finding a cure. In addition to that, if you'd like to learn more about my personal journey, you can go to Daily Chronicles of Cystic Fibrosis.blogspot.com, and you'll be able to read about my medical status, my personal history, and just random things that I think about throughout the week. I really appreciate you guys taking the time to watch this video, and I hope that you've gained something from it. Thank you.